Hello everyone, welcome to Dentospedia, one of the best platforms for global dental board exam to simplify dentistry for students. So let us begin with the chapter. I am going to give you a short lecture from Endodontic module, that is the case difficulty assessment form. The case difficulty assessment form is a very important topic from the selection of cases for the endodontic treatment. Here we will see a good or bad prognosis before starting the root canal treatment. So coming to a basic introduction, these endodontic treatment success depends on choosing the correct case. So we have to choose a correct case. Some teeth are suitable for predictable treatment while others have poor prognosis. So there are some teeth which cannot be restored. So they have poor prognosis, and this correct assessment help us to avoid the failures and unnecessary procedures. So here we can understand that to ensure the tooth has a good prognosis before starting any root canal treatment or any other endodontic treatment, because it prevents unnecessary failures and avoid the teeth that cannot be restored or saved, and also to protect the patient's safety before checking the medical condition and matching the case's difficulty with clinician skills, reducing the procedural errors. So coming to case difficulty assessment form, now this form helps to classify the cases with minimal, moderate and high difficulty. So this form helps us to identify the case as how much difficult it is, as minimal, moderate and high. And it assists in deciding whether the case should be treated by a general practitionist or a student or a specialist. The factors that includes are patient related difficulties, diagnostic related difficulties or any tooth related difficulties. So let us see these difficulties in thorough. The assessment form identifies the three categories. It identifies the three categories consideration which may affect the treatment. So first is the patient's consideration. First is the medical history. So we have to take a proper case history before starting any of the treatment. A patient might be having hypertension, diabetes or any other medical condition, and we will change our treatment plan according to that. So we have to see medical history. Anesthesia, patient's disposition, that means if the patient is anxietic or the patient has uncooperative behavior. Mouth opening, if the patient has reduced mouth opening due to trismus or oral mucosal subfibrosis, which is a precancerous condition, or gag reflex or the emergency condition. So these are the patient considerations. Coming to diagnostic and the treatment consideration, we have to see a diagnosis. Radiographic difficulties, it may happen in the case of reduced mouth opening, for example in the case of trismus. Positioning of the arch, tooth isolation, sometimes the tooth is so badly destructed or the crown is so badly destructed that the rubber dam placement is difficult to be placed. So tooth isolation is also an important factor. Morphological aberration of the crown, canal or the root morphology, how the canal is formed, how the root is formed, if it is curved or straight root or canal. Radiographic appearance of these canal and resorption. Then coming to additional consideration, first is the history of trauma, history of endodontic treatment or any periodontal or endodontic conditions. So these are the categories we have to see for dividing the case in the moderate, minimal or high difficulty. So coming to level of difficulty, the level, criteria and who should treat. First is the minimal level. So it has straight canal. So if the tooth has a straight canal, normal anatomy and the patient is also healthy, then a general dentist or a student can treat it. If the patient is the level of the difficulty is moderate, if has moderate curves like this in the picture we can see, or moderate radiographic difficulty or partial calcification, experienced dentist should treat it. And in the case of high difficulty, the tooth has severe curvature, that is more than 30 degree, very important from exam point of view to remember this degree, that is more than 30 degree, or S-shaped canals or open apices or extreme gag reflex that the patient has. So in the case of this high difficulty cases, an endodontic should treat it. So thank you everyone. This was the short lecture from endodontic topic. To study the topic in detail with diagrams, flowchart, and MCQs, download the Dentospedia app today. Thank you.